Yes.
Can we rise for the pledge, please? Pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So, call the meeting to order. Everybody had a chance to review the minutes?
Second.
All in favor?
Aye.
Opposed? Carries. One quick change, the problem gambling awareness month, we will be doing that at the Ledge meeting. They like the camera, the picture, the press, so we're gonna let them do it that way. Mark, you're here. I just told them you weren't gonna be here.
No, he's not here. I made it back.
You made it back.
I'm not missed it.
Boy, I just get.
I see a little.
That gives you a nice, warm, fuzzy feeling there, buddy.
Oh, come on, man.
Okay, we have one resolution. G1, authorizing the health department reclassification of the RN position. Ching Chang, you wanna,
Yeah, and this is an RN position in early intervention, or usually we call children with special needs program. And as you know, county have a lot of challenges to recruit registered nurses. So it's not gonna make sense to put an RN work at not an RN required position. So this, I already assigned this RN to preventive, because preventive we have job open for a long time, no one applied for it. And so that's why we want to reclassify this position from an RN municipal representative to education specialist represent the county. That's the reason.
I'll move it.
I'll second it.
second?
But I got a question for you.
Any questions?
Yes. With the way this is worded, and please, I'm just a poor boy from Penalville, but I'm a little confused. Is there something in the state or the federal program that changed the classification or wording or a new law or something, that why we're reclassifying this name? Or is it something we've been doing all along and we've been out of classification?
Do the same, the job not to change. The job not to change, just the people with credential, we make it a change. And as I said, this job is called municipal representative. Represent the county at the school district, and the school discuss children's special education needs. And this is not a change. The change is just that previously, yes, county required this position either an RN or a social worker. And now we feel, no, we don't need to keep this high level and a retired teacher with teacher license. So that's how we came here. And it's not this program state changed a lot in recent years, but this reclassification is not related to state recent years change. Just in terms of workforce, we need to make change. Let every RN do RN work. Otherwise, long time gap in registered nurse workforce, we don't want to keep it. That's the reason. I'm not sure I answer your question.
Not exactly. Because we had somebody doing this position already.
Yes.
Okay, we're just changing their name. Here we are.
Richard, Phil can help you with this.
Under education law, the person doing this position has to be certified or licensed. but they can be certified and licensed in areas other than an RN. So that's why I want to not have it designated as an RN, but as an education specialist.
All right, so we have it out of classification.
Right, it broadens our ability to reach more certified people for this position.
We don't have a person doing this job now?
You may have a person doing the job now, but the health department is classifying all of its RNs into its nursing position. So this is just a reclassification title that recognizes that you don't necessarily have to be an RN to do this job.
All right, now let's go to the money part of this. Present salary and hourly rate is $30.92. Is that correct?
Yes,
Okay. And the new rate is $24.23?
yes. Because this person work in county for at least more than 10 years, probably close to 20 years. So that's because county's rule, everybody getting new position start at a baseline salary.
All right, so there's gonna be a savings then?
Yes,
Okay, so there is an impact on the budget? That's all?
yes.
Okay, all right. That answered my question. Thank you.
Right?
I'll go a little bit further. It's in wordage down here. Last words on recommended action. Okay, so there should be no increased cost. Difference between should and will makes a big difference. Not that I would rather see you tell us that there will be an increase, or there may be an increase, rather than there should be no increase. Because one, as far as a service to this group that you've got to show this service to, I don't mind paying more if we're going to keep a good person. I'm not worried about that. But it's just a wordage that says should be. I don't like the words when they say should, because that tells me look out, because it's going to come up later, which I don't mind coming up later. But tell me now. Don't tell me later. That's all I'm saying. It's just a word.
Okay,
It's just a word. Will and should is two different words.
okay. And,
That's all. That's all. I mean, I'm in favor of it because I know that the service that it's going to render. Okay.
Drenching, is there a person doing this job right now?
the answer is no.
Okay.
And after you approve it, we will recruit one.
Okay, so they would, the intent then is to recruit someone, and they come in at the base salary.
Right.
Now, the only way that it would be higher than that previous salary is if the person who's the successful candidate has been with the county for an awful long time, and they move over, you gotta put them at a level commensurate with what they were making. But I don't know whether that's, if you got anybody in mind or not, but absent that happening, the salary is lower.
But to go back with what you
But it's within the same grade.
To go back with what you just said, okay, I just want to get clarification, okay? Because you're saying there's nobody in that position now. Did we budget for that, to have that position filled, so there won't be any increase? But if there wasn't anybody in that position and we hadn't budgeted for it, then we've got to move money at some point in time to cover that.
It would be budgeted at its current RN right now.
But did we budget for it already, or are we going to have to budget for it?
No, it's already in.
It's already in.
That's what I'm saying, if it's already in the
At the
budget.
current RN salary.
Right.
So even if there was somebody that
That is
came
what,
on
that
there,
is,
So the likelihood is it's gonna be less, yeah.
right, so it's already been budgeted for, we just didn't have anybody in that position, right?
correct.
Okay, all right. I'm happy, I'm not against it, I just want to make sure everything's out on the table.
Mhm.
So if somebody says, well, geez, you're adding people, you're adding costs and stuff like that. But I'm happy with what you're doing, thank you.
Any other questions? All those in favor?
Aye.
Opposed? Motion carries. All right. Doc, you know what, I do want to change one thing.
Okay,
Let's do the rabies thing. because I've probably gotten 6 phone calls from people. I know you think this is funny.
I got all 6.
One of the most contested things we do every year is set the rabies clinic schedule.
Yeah, and the reason it becomes an issue is we have a couple of towns that traditionally they switch with each other. One gets it one year, another one gets it the next year. Did you pull up last year's?
Yes, I sent it to you.
Okay.
Do you want a couple copies of it from last year?
What, just where they
It
were?
was, yeah, the location of it.
Yeah, because one of the phone calls was, this is not fair, they've had it 2 years in a row, it's not theirs to have 2 years in a row, it's our year to have
And
it.
I can pull it up on my computer.
You could, if you just pull it up on the computer. So Hastings is one of them that normally switches with somebody. Hannibal normally switches with Granby. I don't know if there's a third one in there, I know there's a couple of other that have asked. In the past, though, this committee, several years ago, kind of went with some of the recommendation from Doc because the number of attendees at some of these clinics is much greater than some of the others that are alternatives. And the idea is to get as many animals vaccinated as possible. That's the end game. So what varies on last year's from this year? Any of it?
That was last year's.
But you could just, if you want to read it.
Just read them off.
Yeah,
Yeah.
sorry.
Okay, last year's, Scriba Highway Garage, this is the County Highway Garage at Scriba, the County Highway Garage at Pulaski, County
Yep.
Highway Garage at Parish.
Yep.
Yep.
Town of Hastings Highway Garage.
Okay.
Town of Granby Highway Garage. Bristol Hill.
Yep.
And then County Highway Garage at Pulaski and County Highway Garage at Scriba.
Okay, so the other one that I've heard the conversation between Hannibal and Granby, that this is the way we've done it in the past, so it is Hannibal's turn. Mr. Martino says it's not Hastings' turn.
We had this conversation last year, and I remember specifically throwing Minetto and Oswego towns into the mix, and I've spoken to them, and they used to have them there.
Okay,
And they no longer, they've been ousted, and I remember your explanation last year that it's easier for them at these locations, but I don't think that the towns that have been arbitrarily excluded should be excluded forever. That's my opinion. We talked about maybe changing it this year, last year, and well, let's go with this year and we'll change it next year.
well, we're at this year, and that's why I brought it up.
So the change would be West Monroe instead of Hastings.
Yeah, that's the one that Martino called out.
And we also pointed out last year that on the west side of the river, they only have one clinic. Either Granby or Hannibal.
Over there.
Yeah,
Granby or Hannibal.
Well, it's just that there's not a lot of population over there. The majority of the population follows up down through Scoop on Hastings and Fulton, Oswego.
so,
Well, half of Oswego's on the west side and half Fulton's on the west side.
And then not exactly half, but yes.
okay.
A good enough amount to have an
Okay,
extra.
so before we start throwing ping pong balls, because they're softballs, you need to give some input on
Okay.
numbers, what works, what have you tried that don't work, and what are you open to?
Okay. And before I came here, and health department run about 20 clinics every year. Okay, and this at that time funding is okay probably, but currently if say this town want us to go, this town want us to go, that town want us to go, we don't have resources. And truthfully, 8 clinic from March to November, it's our maximum. And state funding requirement only require us to do 4. Because most of the funding came from state funding. It's our obligation, but our obligation is 4. We maintain it's 8. Since I came here, I think 2012 till now, we maintain it. And the second thing, because this as you know, this is an issue for many, many years. And the reason choose county location like Scribe Garage, Bristol Hill, and Plus Sky. And I was told the reason this separated was because they look at it and mostly in these spots we spread include West Monroe and Granby and Hannibal, and every corner in the county to any location is less than 15 miles. It's a reasonable distance people are willing to go. And that's why many events, we don't need to think about these two cities, half river east side, half river east west side, because we consider it's 15 miles and people can easily access. From my experience with COVID-19, I find that yes, people are really, they are willing to travel, I don't know how far distance from Cleveland to Williamstown to get the shots. Specifically, I ask, this is, to me, it's a long distance. Many say, no, this is not that far. So all this clinical arrangement is, I think, yes, if in terms of time and the distance, most residents accept it. And as Chairman said, some events work alternatively every year, work very well. So that's why we put it here.
Go ahead. Just also for the community's information, Judging's right. There was a time in the county's history when we did an awful lot of these every summer and fall and spring. And when we made that transition to 8, this was several years ago, the health department did a analysis, cost-benefit analysis, and found that the 8 was sort of the sweet spot. That when you had 20 or so clinics, we were actually doing fewer animals at a higher per animal cost. You get down to these, we were getting more animals, and the cost per animal to the county was lower. So that's why we've tried to stick with around the 8. It seems to be the most financially efficient and getting the most animals done. I don't know if I still have that analysis, but I could go dig for it at some point if anybody wants to see it. Because it was probably 8-10 years ago.
I personally don't have an objection if they wanted to take like the last guy and Squire off at the end or something, take 2 of those off and try someplace different. I am concerned because I have gone to several of these at highway garages and they are packed. They are a line. And if we have done a couple locations in the past, they're really, as Phil said, the turnout was not all that good. And you've got a lot of staff and volunteer involvement in this. There's a ton of people there that have to be there. I mean, they got groups that are out there. They're poopers, scoopers. There's people that coordinate the line. You've got vets. You've got county staff. You've got people recording. I do not object to this. If you want to make a couple changes, I think that the 2 duplicates at county could be changed. Yeah, I'll get you in just a second here. But I will tell you, this committee is going to hold any changes feet to the fire, that if we do it and it doesn't show the numbers, we're not going to do it again, because this is not about vanity. It's about getting animals vaccinated. The alternating between Hannibal and Hastings, the counterpart of that, they're pretty much equal.
No, Hannibal and Granby.
Yeah, well, I mean, no, I'm talking about Hastings and West Monroe and Hannibal and Granby. The numbers don't really change a lot between them. And they have a system. And I will tell you, the system is very important. The highway garages work extremely well because most of them are set up. You can go in one door, go through the system, come back out, and come out another door. If you don't have that kind of highway garage, you create a lot of double pattern, and with a lot of dogs, and some of them not very nice, that can be difficult on people. So there is a piece of that. Now, you said Minetto is interested in doing this.
Yes, but I want to comment on what you said. Last year, when we brought up Pulaski, I heard Jurgen say that there's a lot more than just Pulaski to come. That there's a lot of area up north that draws that in. So I don't think we should touch Pulaski.
Well, they're down twice.
I know, but
Okay.
because they have such a large area that come.
So maybe the Scribble one's the one. We try one
Perhaps.
different this year and do something like that. Yeah.
I was gonna say, I remember when we changed this, and when it was changed, and it was done just based on, it's, bottom line, follow the money. It was the bang for the buck. And Pulaski, I always end up there because I wait too long and I have to go there. But the thing is, Herb's right, because there's a lot of dogs up in that country. Don't ask me why, but there's a million of them. So, it's basic economics is why we end up with this type of schedule.
Yeah, I understand economics completely, but the problem I have is that every 3 years I gotta kill a rabid animal in my barn. You and I have had this conversation many times in the past about rabies in Minetto, and in the town of Oswego and in Granby. All in that area, there's a big pocket of rabies in that area where we have to kill animals constantly. My horses have been attacked. Luckily, none of my people have been attacked, but still, it's a chronic problem in that area, and I would like to see, something done in that area for the people who live there.
No, this issue is slightly different from this.
Well, they still have to get their animals vaccinated. It's my point. It would make it easier for them since it's such a high area of this disease. I'm not saying that most people can't drive 15 miles, but I know one guy who's got 5 cats and he only rides around on a bicycle. So I don't know how he's going to get his 5 cats over the Scribble. There are people like that. Normal people, average people, don't have a problem getting in the car and driving 10 miles, but there are people that don't have the availability, and I can guarantee you they're not getting their cats vaccinated if they're not getting a ride there, That's throwing it out there.
How much of a wrench do we throw into this if we took Scribble out and put Minetto in?
Because while the animal rabies and the last year state and the federal government did a bait, yes, bait and airdrop, and this is a very effective program. And when I was in Maine, and they did it every year, and I really hope, yes, we can get this kind of program here, if not every year, every other year. And this is a very good program, and this is because this rabies is not just pets, and it's, yes, wild animal, you're right, and we need to protect our pets to protect ourselves, build a buffer there.
But one thing we have to be aware of and be careful with, just like you mentioned, Jim, a lot of dogs don't play well together, and that just is what it is.
Yeah.
And that's why the highway barns, the slang for it, are so well equipped, because they're big, they have a lot of doors. You go to a town, a lot of these local municipality fire departments and like that, I got a couple of them, they're small.
Yeah.
I mean, you're gonna have an interaction of just problems, and not enough room for the people to work, to really put this through. Because the volunteers and the veterinarians and everybody that does this, they do a fabulous job, and believe me, they work their tails off for a couple hours.
Yeah, that line moves all the time. Are they equipped for this?
I spoke to the firehouse and they said they were prepared to do it. They've done it there in the past, but
Okay.
I'd have to reconfirm that. That was last year when we were having this conversation. I haven't been updated since then.
Okay. I do think it does put a second one on the west side of the county, which is good. I don't think that the town of Oswego, you or Minetto, they're close enough to each other.
Yeah,
It serves the
I know.
same population. I don't have a problem with taking the bottom Scribble off or the first Scribble off, and that if you don't have a problem with it, that's going to be a major issue for you. We need to know it now.
If you want to take off, don't take the first off.
Take second one. Okay.
If you want to try, take the second one off.
And we'll leave the two Pulaski on. I think
Yep.
that's good comments. And we'll let the other two alternate. The other question we have, though, is West Monroe is going to raise hell because Hastings got put down 2 years in a row, and it normally alternates.
So we should put West Monroe in number 13.
What,
It's a committee decision.
West Monroe off the list was because West Monroe, their garage call our department and says they don't want us to go back.
Oh, then they're off the list now. Let's solve that. Now we're just down to that decision.
So no on West Monroe.
No on West Monroe.
This was West Monroe, their highway department call our health department.
Okay.
It's a lot, it's a lot of work.
wants it.
It's a lot of
I have to
work.
reconfirm that. That was last year, that conversation. That was, we had this conversation before. I wasn't here this week to.
Okay.
But certainly we could tentatively schedule it.
We can schedule it, and then if they back out,
Go back to Scrabble.
we'll switch it back to Scrabble before.
Jenshing, when did was that last year, or when did West Monroe?
Years ago.
I think probably 2 years, in the past 2 years in
Might
Hastings.
want to
Yeah, so
check
should
it then if
we-
you got different people.
Yeah, not last year, I think 2 years.
Well, we can put that back on the legislator that represents that district too.
Well, I know for, Cleveland, it's quite a bit further to go to Hastings than it is to go to West Monroe. But, it's not like we have a ton of population there either.
But you have 5 dogs. I've seen
Well,
4
we
of
got a
them.
lot of dogs. I know people use it, and that I would be, and I'm surprised to hear that West Monroe said no, because, who was that somebody from the town?
I can check with our environment health, and this was their garage. Say they don't want us to go back.
So it was more the highway
Yeah,
superintendent.
it's usually the highway superintendent that either agrees to it or says no, because it's their facility that they manage.
You usually we not talk to town, we talk to garage, each garage, what county garage and or local
I'm
garage.
pretty sure Vern Sundet would be happy to have it there as the town supervisor. But he's not the town highway superintendent.
Would you like to bring it to next month and we'll get some answers?
I think.
No, we cannot wait until next
Yeah, we're
month.
here.
I need to send out, at least you give me 4. First give me 4.
Okay.
We can run.
Well, you can, yeah, the first 3 you're good on. West Monroe is your number 4. Hannibal's fine because Granby had it last year. Bristol's fine, Pulaski's fine. And then Minetto, depending upon the conversation that Mr. Greco has with the highway superintendent. If he starts laughing, you should probably call us and say, don't do it.
Now, Mark, did you say, is it the fire department?
Yes.
Or the highway garage?
The
Yeah, I
firehouse.
think
It's a firehouse.
That's right off 48.
Yeah,
That's right off 48.
yeah, and their highway department is not conducive to doing this type of thing.
No, not Minetto, I don't think.
Yeah.
No.
Yeah, it's
But the
work,
firehouse has done in the past.
it's work at Hannibal and Granby. I mean, you've
Yeah.
been there when Granby did,
Yeah,
and
and
it's work.
it is involved, and it comes up to a highway superintendent, whether he wants to have the crew move the equipment out, clean the garage, block off the stuff where people can't go, so it's safe for everybody working there. And then it's usually, you pay one employee overtime to stay for X number of hours. So it's only 3 hours pay for that, but it's just a choice to serve the community, and it has worked out very well in Granby. And they are busy, let me tell you. You're chasing dogs, and I've done it. You're chasing dogs and cats and people screaming out there at different times, and if you can think it has happened at one of these events.
Okay,
So first 3 is settled.
first 3 are settled.
I need to go back to their house, environmental health.
Number 4, we will
First 3, okay.
contact, Mr. Martino was concerned over that, have him find out.
Is that something your environmental health folks can call West Monroe and see if it's still true? They don't.
I can ask them. Yeah.
Yeah,
Why don't you do that?
and
Okay.
Just to double check that wasn't a one-time, maybe because something was going on at the garage, or
Okay.
we just want to make sure.
Yeah. I will ask them.
If they're okay having it, that can be changed, right?
Yeah.
Because that's been the history of it? Okay.
Okay,
And the other ones are fine, and then you're gonna check with Minetto one last time to make sure that
okay.
the fire truck doesn't have to scream through 30 dogs that are standing there barking.
I'm gonna be there with my video camera. Just in case.
If we're gonna change Friday, which is that's a big dog and cat destination, we really gotta make sure the media puts that out there as only gonna be there one time. Because a lot of people will be putting it off.
He's gotta go door to door to get the people.
Well, that will keep busy.
I don't think it'll be a problem. When we used to use it, we never picked it on location. We picked it on our calendar. And we took them to Pulaski one time. And we took them to Hannibal one time, It was their turn that year. Granby wasn't doing it. They were both up that year. So I think there's a lot of that goes on. It's not so much, I'm gonna rearrange my life to meet this schedule. I think that does happen, but there's a lot of other people that are gonna say, this is my time to be able to go do it. By the way, where are they at? Oh, then that's where we're going. All right? Do we have to have a motion for this?
Wouldn't hurt.
All right. So we need to make a motion that we've totally.
So moved.
Second.
Second? All in favor?
Aye.
Thank you. Now you can go. I knew this was gonna
Okay.
take a couple of minutes. I wanted to make sure if anybody left early that they had a question on this.
Today, our environmental health director, she feels not well, so, she will not be here and let me, entertain you. And, as always, I put the, COVID-19 situation and then give you a brief, department introduction. And, I hope, yes, next month, each division will come to present it to you. Okay. And, yes, this is always, you see my first slides, and, this is the first one, March 22nd, 2020, and we have first case, and this end is the most latest, February 27th, 2 days ago, and you can see, we have this peak and keep it dropping, and this is the whole these 2 years case. And because we're talking about the public health, and over these 2 years, as you know, we did a non-pharmaceutical intervention, and we did a vaccination, and now we have treatment, and a handful medication for treatment. It's already approved. It's not my field. I'm not going to touch it, and I want to focus my report with vaccination, because this is still something, even our local data, very small data, still show vaccine is effective to protect the people. And this is the overall vaccine coverage rate by age, and you can see in the county high age group they are well protected, and the younger age, yes, much less, and the realistic is, yes, younger age, less severe cases. But the bigger concern is really the middle age group, and our county's deaths range from 29 years old to 100 years old. So comparatively, yes, these senior ages are well protected, and this younger age is some concern. This is county data, very interesting, and this is almost covered the Omicron period in the middle of December last year to middle of this month, no, past month, February. And we look at it, and you can see, and this graph show vaccine status. And this table show chronic disease conditions, underlying conditions. So you can see over this period and in the county totally we have 34 deaths. Among these 34 deaths, 20 of them never vaccinated. And this is 59%. And 14 of them fully vaccinated. And these fully vaccinated deaths is 41%. Among these 14 fully vaccinated, 3 of them, they had booster dose. So booster dose there, because I put it separately, different fund. The reason is because this added together 100%, and this 3 cases is in the 14 cases. So you can see, I think not a surprise, this to boost protected those still die there in old age group. So if we look at the chronic condition, because talk about the severity of COVID-19, the top, because this is not based on county data, published study show the first risk factor is age. The second risk factor is obesity, diabetes. And our group, because our sample is small, so I just divided them with no chronic condition, 1 chronic condition, and a multiple chronic condition. So when I talk about the chronic condition, age is not a consideration. Okay, age is not considered as a risk factor here, and equally located. And you can see without a chronic condition and in younger age group, we have 2 deaths. And the middle 56 to 64, 1 death. And above 65, 3 deaths. And totally 6 of them, none of them had vaccinated. For 1 chronic condition, and we have 9 deaths. And among these 9 deaths, you can see 7 of the 9 not vaccinated. And if you look at the multiple conditions, and we have 19. Among these 19, two of the 19 is fully protected with booster dose, are these 2. So these 2 graphs really show vaccine is not to protect infection, but still protect severe disease and deaths. Sorry. So this is these 2 tables show here. And look at our county's vaccine rate, and this is from CDC. And I compared, because last month I showed the same table to you, and this vaccine first dose and the second dose increased very, very little. Very, very little. Yeah. And this is our county data for booster dose. And the booster dose in compared to previous months and increased percentage-wise, every age group increased between 0.9 to 2% increment, because now vaccine is widely available and people really, I'm glad, and people taking the vaccine. And this is a comparison with Oswego County with other four central New York counties. So yeah, the rumor on the street is always say Oswego County, everything is not good. But if you look at the Oswego County, it's really not that terrible as the street rumor says. And you can see this column is Oswego, Cuyahoga, Madison, Onondaga, and Cortland. And you can see for all age group, Oswego County only lower than Onondaga County, but higher than Madison and Cortland County. If we look at the age group above 18 years old, and we are higher than the other three counties, lower than Onondaga County. And if you look at the age group above 50 years old, and you can see the same, and our vaccine rate is lower than Onondaga County, but higher than the rest of the three counties. And for senior age group above 65, in the region we are the highest. And also this rate, and also if we compare with Onondaga County and Oswego County, you can see this in the past 2 weeks also, and you can see Oswego County vaccine coverage rate in these two age group, and we're slightly higher than Onondaga County. Here, like we increased 2.2, and they increased 1.7. And for this group, and we increased 1%, they increased 0.9%. So I said yes. I'm very thankful for our staff, and they go out and keep vaccine events in the community. And also I'm very thankful to pharmacists and healthcare providers, and they keep vaccinated our residents. So this is the summary since our vaccine clinic started last year, January. This is the last year, January. And this is the past month, February 2020. And you can see, just I'm talking about these 3 months, yes. We are very, very frustrated, and we look forward, okay, we can go out and do 100, 200, and in the past months, very, very low, and I think, yes, we, January, sometimes a clinic, Wednesday afternoon clinic, we can get like 100, 200, and now it's Wednesday afternoon clinic, we have only 20 or even lower than 20. When we go out, like most recently, we went to Polish home in Fulton. And it's a good location, and we thought we can attract many people, and the organization was very supportive, and they put their electronic board and make announcement 3 weeks ago start, and we had only like 19 or 20 shots. So this is reducing, but still. We will continue our efforts and promote the vaccine and protect the community for hospitalization and severe cases. Let's change another topic. As you know, CDC changed their community COVID-19 measure, and in the past, and in this committee last year heard about the community transmission level, and now CDC just call it community, COVID-19 community levels by the county. And you can see Oswego County, here's Oswego County, and they divided the community level into 3 levels. Orange is high, and yellow is medium, and green is low. And what they measure is, they measure 3 indicators. The first indicator they measure is new case, daily new case per 100,000 population. And the other 2 is measure hospitalization and new admission, hospitalization, new admission, and the percent of inpatient occupied beds. And last Friday, CDC first time published it, and they will send out this by county community levels every Thursday. And I look at it, yes, when they reported our county's new case rate was high, and should be less than 200, and we have potential go to medium and low. And county last week when they reported, and their cut line is 200, and our county was at 256. And also I look at our new admission lower than here, but our patients, they occupy beds percentage-wise higher than here. So we still have 2 indicators keep us at this level. But I want to say the case rate dropped very drastic. And 7 weeks ago, our 7-day accumulated was like 1,300 or something. And most recently we dropped it to 288. So this will drop quickly, and if things move forward, yes, probably quickly we will move to medium level. But still a little bit concerned probably is, yes, hospitalized occupied percentage of beds. So this is our community situation.
Can I ask you a question before we move on? So what's your, so let me first say, I mean, you guys have done a valiant effort. I mean, I think that goes without saying in terms of all of the work that you've done. Number of clinics, the outreach you've done, I mean, it's just, to keep kind of where you're still at is just amazing in my eyes. But I think that it starts to beg the question of what's the metric that you will use in terms of resource dedication to COVID-19, given kind of where you see, and I think it's somewhat apparent in terms of our own sort of county trend lines, not from the actual case count, but my guess is you're starting to experience this sort of, coin a phrase, a kind of a COVID burnout moment, right? Where it's just, for folks, you know, I think some of us were even talking yesterday, the ability just to give away tests at this point, it's like, you know, you can't even give them away because folks are kind of at that place where, and I'm not saying it's everybody, but there's certainly a population that is just done, right? They're done with tests, they're done with vaccinations, they're just done, right? And so, and my guess is some of the numbers that you're talking about in terms of vaccination clinics and numbers, it's reflective of that sort of place that people are at. So where do you start looking at, well, you know, we're doing 20 clinics a week now, and we're getting 10 people per clinic. When do you start saying, hey, if somebody wants this, we got to get it, you got to go to one of the 10 clinics that we're having now, not 20, and you start looking at your staff resources and saying it's time to kind of rededicate those staff resources to either to other things or just simply dropping the number of clinics that you're doing. And I'm not suggesting that you're at that place, but I don't know if you've thought about that. And
We because if you go back to previous slides, and you can see, and really this vaccine is protected severe cases and protect deaths, and we still need to protect the vulnerable population. And yes, if you say when is our burnout, and I can truthfully tell you, if health department will be burned out, and our staff already long time ago. But this is really just their professionalism and dedication keeps them moving forward. And we have not set up a threshold. Below this threshold, we are not going to do anything. Mm-hmm. But what we plan to do is a couple of things, and we may not do a lot of outreach, and we will reduce it. But for this homebound population,
sure.
And for those remote area, for example, like northern country and plus guys Sandy Creek, and we may keep our efforts. Mm-hmm. And also we will keep our in-house clinic, because we find that, yes, because at one side is people with less intention, but now what we are going to do is we will open a whole day, every week a whole day, and you walk in, we don't care. I punch a vial and only one dose used, because vaccine is plentiful. Mm-hmm. And just walk in, any age, and we will give you Pfizer vaccine. This is our plan. Mm-hmm. And we will not stop our efforts. If not this flu things, and we have lead poisoning, we have other communicable disease, and we have other like overdose issue. So many things we will work on.
Sure.
So we will not stop. Okay. So this is my report about this COVID-19. And before I go there, and let me finish disease reporting. And it's very interesting. And last year, the last whole flu season, let me finish disease reporting before I go there. Last year, whole flu season, usually in our county, we will get at least 1,000 cases a year. Last year, because of this pandemic, and we had only like 12 or 14 cases of flu. And this year still COVID-19 dominant, and so far we got 84 cases of confirmed flu. So this is my disease report. Okay. So, and now let me introduce you about our health department. And sorry, I cannot bring a health environment health division to you, and we will bring to you next month. And also I learned that next time I will not put a specific environment health. I just say division update. So anything I can grab.
You can be flexible.
Yeah, be flexible. Otherwise, I have to follow this schedule. I don't want to add more. So this is a very general introduction. And the Oswego County Health Department in state health system, and consider a full-service local health department. A full-service local health department should include preventive services, and specifically, yes, this disease we need to include. And the chronic disease, it's reportable condition, I think with 30 or 40 diseases, and the rabies immunization program, TB treatment, STD treatment, and include the HIV contracted to OCO. So this is the one. And another one bigger obligation is environment health. And here we make a long list here. And public water supply, community environment health, and food inspection, rabies prevention, and tobacco control, and lead poisoning, and mosquito-borne disease, and also public health nuisance and the sewage system complaints like this. And the third component is emergency preparedness. And as you know, because I think we make drill every year, and this really greatly help our COVID-19 response. So this is the full service definition. And for county, the good thing keep local health department as full is because state give basic funding. In the past years was 650,000 basic funding, and after that, and get the cost within these services get 36% reimbursement. And this year's state budget not passed yet, and the recommendation is 750,000. So this keep a full service local public health. It's good for the county's benefits. And when our finance people come, they will tell you more. And this is our overall goal, and I'm not going to read through it, and I think some of you already saw it. And when we talk about the department reconstruction, and we already presented, and still, yes, we will say COVID-19, and also mosquito-borne disease, and still, as a program, we will continue put our efforts, improve efficiency. And this is another exercise we did a couple years ago, and this is sure some people may think about this is just a bureaucratic exercises and strategic planning, but to me, I feel strategic planning is very helpful for our department, especially our department management team, very active. And if you have a chance, yes, you're welcome to come to our meeting. And for so many times, and always 2 managers, 3 managers argue about use limited resources. You want your program, I want my program. So no, you don't need to start to argue, and let's go back to our vision, our mission, and see what's the priority. So this is a very good exercises, and really I think also this process we did about 3-4 months, and involve almost every staff, all level, every staff in the health department. They may not tell you what's their mission, what's their vision as we type here, but at least they know what we are doing, and it's a wonderful team. And this is a very busy org chart, and I just wanted to let you know, yes, Jianqing is here, and Phil is here, and your committee is here. And, and we have Dr. Lepke here, and finance here, and these are very busy each program, and environment health, and you can see, and I feel harder to read, and this preventive services, and the healthy family, and education is here. So this is a very busy team, and we will never feel nothing we can do, and we're always active there to protect the community. I think this is the last slide.
I got
That's
a
all.
question.
Yeah.
Going through your slides there and your priorities and lead paint, water quality, which is so important, believe me, it is real important. Do you touch on mental health law?
Mental health at the county system is at DSS. But if you expand the mental health a little bit, include suicide prevention, include drug, now called substance use and overdose, yes, we are actively participating.
Because that's a major problem in this county is mental health.
I agree. And this Oswego business and last week, probably or 2 weeks ago, and contacted me and asked. I give some of my thoughts, and I said this mental health is a huge burden for the country, and specifically I say this COVID-19 exacerbated our situation, and I give him some thoughts, and I asked him to go to DSS mental health director to get more input, and I don't know why he still came back and he said he wants my picture put there. I said no, not my picture. Put the health department, not health, mental health workers picture there, not my picture. So.
All right, and one more quick question. This term has come up a lot in the media, and apparently they're quite important because they've been speaking a lot. You're epidemiologist, or whatever the heck it starts with E.
Yeah. Epidemiologist.
Yeah, okay, I've been working on it. How's our, because this is the person that provides you with statistical analysis of where problems are.
Yes.
That's what their function is.
Yes.
And I'm a statistics guy.
Yeah.
Statistics don't lie, people do, okay? How are we making out find this? Because that's a very key, in my opinion, a very key piece of information that we need from our health department.
Yeah, and thank you. We restructure, yes, legislative claim. You were there, and you know we requested some data people. We requested some epidemiologist position, and eventually HR put them all into epidemiologist position, and we are working on it. And we have this public health core training program, and we are going to recruit some and train some, and I hope after they get trained and they will come back and stay in health department. It is important because epidemiology and statistics are the foundation of public health. It's important, I agree. So we're working on it and get this kind of skill. But as a Lulu County, it's harder to get this kind of skill set. Honestly. So that's why we train. Yeah, we're working on it. Yeah.
Good. And for those that don't know that, Doc is an epidemiologist. So that's why you see the breakdown the way you do. Question? Go ahead.
Yeah, I'm curious of your professional and personal opinion in regards to removing the mask in the school as a lesson.
This is I learned from my public health practice is really the best policy is not a policy come from up to down. The best policy is you can persuade the people, let people understand it, and let people accept it. So for this school things, I think, yes, I understand, and I understand CDC still ask or recommend county community at high COVID-19 level, school keep a face mask. But to me, this yes, over weekend, and I struggled a bit, and whether we yeah, I can openly tell you, and I was thinking whether we follow CDC say school keep a face masking, let's keep a face masking. And on the other side is really, we need to think about our community situation, people's acceptance. The reality is, sure, sorry yesterday, Phil, I didn't have this chance to talk with you yesterday because I was prepared things, and on the other side is, if you look at our community reality, if health department yesterday said, yes, let's follow CDC's guideline and require every school keep their face mask on, and people just will not accept it. It's not that every people will not accept it, but this pushback, it's unnecessary fight. I'd rather put more of my thoughts, work with my team. Let's find out whether we need to go to Hannibal again, whether we need to go to Plaska, whether we need to go back to Cleveland, instead of we need to answer 12,000 call and 12,000 email explain this situation. So, to my opinion, yes, I understand CDC, their recommendation based on science makes sense. But for our community, and we need to let people understand our efforts and understand their risk. That's why yesterday I worked on this this table, and I show you, analyze our county deaths. This information we need to tell people. And because currently our major goal is not, I'm not to say it is not important, it's not the general population, it's those most vulnerable population. We need to put a focus on these people. So I don't want to get distracted for probably, yes, not just my phone, and the chairman's phone and the Phil's phone all will jam up. Why you make this recommendation? No, but no, our focus is really the most vulnerable with multiple chronic condition, with senior old age. These are our focus. But you saw the slides, and seniors are already well protected. So I needed to persuade the younger age, protect yourself and protect a vulnerable population in the community. So that's why I think, yes, these two tables I will try to push to the community. And our focus, sure, school population is important, but still vulnerable population, they will get a severe disease. We need to protect them. And I can say to you, the youngest 29 years old deaths in the county, not vaccinated, without chronic conditions. I don't know who. Sure, I hope no one tried to search it. This is the privacy breach. But these are information we need to give to people. So,
Right.
Yeah.
You know, just to come off that just a little bit, is that nobody really wants to wear masks. I don't really want to wear masks. But, and yes, people are upset that their kids have to wear masks when they're in school. You say, well, our kids are not vulnerable. why should they have to wear masks? But the thing is that there's teachers, and yes, the teacher may not die, but if the teacher gets sick, then the teacher has to quarantine. Which means, it's just like in a factory. If you don't have somebody to run a machine, you can't run the machine. If you don't have teachers, you can't teach. And it puts a lot of things, at risk because now all of a sudden the education level is gone down because you don't have teachers. And it's just, it's the whole big picture. It's not just the one point that, we want to have the kids without masks. And yeah, I'd like to have the kids without masks. But I also want to make sure that we have enough people to teach, enough people to drive buses. And that's the biggest point right there. If you don't have the teachers, you can't teach. And that's what the school districts look at. But they're going, now you said that in the high level, they shouldn't be reducing. But what is Oswego County versus other areas? What is the city of Fulton versus the rest of Oswego County? What is the city of Oswego versus the rest of Oswego County? What is their rate versus the rest of the county and stuff like that? Those are the issues. And my district, yes, we're not going to be, everybody's going to be without a mask tomorrow. And you just have to, these are the cards that we're dealt. And we're going to have to see if it's a winning hand or not, because in a few months, we may be, right back to where, okay, everything's back being quarantined. And hopefully it doesn't. I'm hoping that, right now I got an okay that I can get that miracle drug. So I'm not worried about it, because if I get it, I can call my doctor, get the miracle drug, I'll be taken care of. I ain't going to die. And I know that makes a few people unhappy, but
You're taking Clorox.
but I didn't want to go on any further because everybody wants to get out of here. But the thing is just you have to watch what the teachers in the teaching profession. There's a lot of senior citizens in there. There are a lot of people that are in their 50s. The young ones, they can get over it, but they're still going to get sick. And the first thing they're going to do is they're going to go out. Why are they going to go out? Because they can, and they can get paid. Okay? So that's why they're going to do it. And you're going to do it without teachers. So I'm hoping that it all passes. I really do. Thank you very much.
Okay.
That's
To be 50 again.
So the order came out to change the guidance from the state for Wednesday. That is not something we actually have to make a decision about, because we're not in the, so we don't have to act whatsoever as a county.
We don't control the schools.
No. Well, I was, the way I read what she said, I didn't see the exact guidance, so that's why I'm asking the question whether, because it sounded like
I think it is.
the counties that were in a certain criteria of high, transmission still had to make the decision whether they were going to or not. So is that is not on us.
I think they have to. I think we have to act if we want to continue the mandate. Correct.
Well, if you wanted to continue it, okay. Okay, I just wanted to, if anybody had seen the actual, all I did was hear the news on Sunday that, and I didn't see the exact
Roy, we're in a
wording.
situation where no action is action. If that makes any sense.
Yes, perfect. That's very good action. I like that. Thank you.
Anybody else?
Yeah, one quick question. First off,
Oh, you're back.
And look at the tan, by the way.
no burn here. First off, thank you. High confidence in yourself and the entire department. My question, I guess, and it may have been covered, you had the CDC map up there and we are listed as a high county.
Yeah.
How often do they look at that number?
Every week.
So it takes another week. So theoretically, per your email you sent me this morning, if our numbers are dropping, we may in effect be out of this high zone
Yeah.
before it gets announced.
Yeah. If today Tuesday, if the day after tomorrow, CDC say Oswego County down to medium level, I will not be surprised.
Right.
Yeah, and if another week, yes, it's a possible. Another week, it's possible. But like these kind of things, all put into consideration, and I think yes, we don't want to be someone and say, oh, today put a mask on, and after 10 days, no, you can take it off. No one wants to.
But that notice from the CDC, does that typically come out? Is there a certain day of the week that it comes out?
Thursday, every Thursday,
Every Thursday.
every Thursday. Yeah.
So we'll have an indication on Thursday.
Yeah, yeah.
Perhaps, and I hope it's all good. And then after, it may continue to go, it might go up, but I believe it's gonna continue.
I think at least this rate, and they look at, I will share this with you later. And the slides I show you, this 200 is the threshold. And I think probably this threshold will possibly drop this Thursday.
All right.
Yeah, but this, because 3 indicators, and one is the population rates, and another is new admission to hospital, and another is a hospital bed occupy rates. And I look at new admission rate is already lower than median, and but the occupation rate is still high. So these 3 indicators, and total population, I hope yes will drop down quickly.
Thank you.
Okay, thank you.
All right, entertain a motion.
So many.
Second.